Asperger syndrome is a relatively new diagnosis in the field of autism, named in honor of Hans Asperger, an Austrian psychiatrist and pediatrician. An English psychiatrist, Lorna Wing, popularized the term Asperger syndrome in a 1981 publication. The first book in English on Asperger syndrome was written by Jutta Fritt in 1991, and the condition was subsequently recognized in formal diagnostic manuals later in the 1990s. Asperger was the director of the University Children's Clinic in Vienna, spending most of his professional life in Vienna and publishing largely in German. In 1944, Asperger described in the paper Autistic Psychopathy in Childhood 4 children in his practice who had difficulty in integrating themselves socially. Although their intelligence appeared normal, the children lacked nonverbal communication skills, failed to demonstrate empathy with their peers, and were physically clumsy. Their speaking was either disjointed or overly formal, and their all-absorbing interest in a single topic dominated their conversations. Asperger called the condition autistic psychopathy and described it as primarily marked by social isolation. Asperger called his young patients little professors and believed the individuals he described would be capable of exceptional achievement and original thought later in life. Two subtypes of autism were described between 1943 and 1944 by two Austrian researchers working independently, Asperger and Austrian-born child psychiatrist Leo Kanner. Kanner emigrated to the United States in 1924. He described a similar syndrome in 1943 known as classic autism or Kannerian autism, characterized by significant cognitive and communicative deficiencies, including delayed or absent language development. Kanner's descriptions were influenced by the developmental approach of Arnold Gesell, while Asperger was influenced by accounts of schizophrenia and personality disorders. Asperger's frame of reference was Eugen Bleuler's typology, which Gilbert described as out of keeping with current diagnostic manuals, adding that Asperger's descriptions are penetrating but not sufficiently systematic. Asperger was unaware of Kanner's description published a year before his. The two researchers were separated by an ocean and a raging war, and Asperger's descriptions were ignored in the United States. During his lifetime, Asperger's work in German remained largely unknown outside the German-speaking world. The German physician Gerhard Bosch, a German physician, was the first author to use the term Asperger syndrome in the English language literature. Between 1951 and 1962, Bosch worked as a psychiatrist at Frankfurt University. In 1962, he published a monograph detailing 5 case histories of individuals with pervasive developmental disorder that was translated to English 8 years later, becoming one of the first to establish German research on autism and attracting attention outside the German-speaking world. Lorna Wing is credited with widely popularizing the term Asperger syndrome in the English-speaking medical community in her 1981 publication of a series of case studies of children showing similar symptoms. Wing also placed AS on the autism spectrum, although Asperger was uncomfortable characterizing his patient on the continuum of autistic spectrum disorders. She chose Asperger syndrome as a neutral term to avoid the misunderstanding equated by the term autistic psychopathy with sociopathic behavior. Wing's publication effectively introduced the diagnostic concept into American psychiatry and renamed the condition as Asperger's. However, her accounts blurred some of the distinctions between Asperger's and Kanner's descriptions because she included some mildly retarded children and some children who presented with language delays early in life. The first systematic studies appeared in the late 1980s in publications by Tantum in the UK, Gilbert and Gilbert in Sweden, and Satmari, Bartolucci, and Bremer in North America. The diagnostic criteria for AS were outlined by Gilbert and Gilbert in 1989. Satmari also proposed criteria that same year. Asperger's work became more widely available in English when Jutta Fritt, an early researcher of Kannerian autism, translated his original paper in 1991. AS became a distinct diagnosis in 1992 when it was included in the 10th published edition of the World Health Organization's Diagnostic Manual, International Classification of Diseases, or ICD-10. In 1994, it was added to the 4th edition of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-4, as Asperger's disorder. Less than 2 decades after the widespread introduction of AS to English-speaking audiences, there are hundreds of books, articles, and websites describing it. Prevalence estimates have increased dramatically for ASD, with AS recognized as an important subgroup. However, questions remain concerning many aspects of AS. Whether it should be a separate condition from high-functioning autism is a fundamental issue requiring further study. The diagnostic validity of Asperger syndrome is tentative. There is little consensus among clinical researchers about the usage of the term Asperger syndrome, and there are questions about the empirical validation of the DSM-4 and ICD-10 criteria. It is likely that the definition of the condition will change as new studies emerge, and it will eventually be understood as a multifactorial, heterogeneous neurodevelopmental disorder involving catalysts that result in prenatal or perinatal changes in brain structures.